Dr. Burton Wood. I'm a head and neck surgical oncologist at the University of Tennessee in Memphis. So I have hospital affiliations primarily with Baptist and then Methodist University Hospital. I'm an assistant professor in the Department of Otolaryngology, Head and Neck Surgery here at the University of Tennessee. Primarily, I treat patients with essentially any head and neck cancer, so that most of the time that's cancers of the tongue, throat, voice box, salivary glands, and thyroid cancers. I went to medical school here at the University of Tennessee in Memphis, and then I left and did my residency training at Vanderbilt in Nashville, and then I did a head and neck surgical oncology and microvascular reconstruction fellowship at WashU in St. Louis. Good question. When I'm asked that question, generally my response is anything but country music. If I had my pick, it would be blues, jazz, funk, that sort of stuff. I really enjoy the accessibility of Memphis. It's got a lot of stuff going for it, and basically you have anything here that you'd want out of a bigger sized city, from music, food, professional sports even, but it's a small enough city that all of it's relatively accessible. You don't have to wait 2 months to get a reservation and that sort of thing.
Mountains or beach?
Probably beach, just because it's what I do more often than mountains.
Pancakes or waffles?
Pancakes.
Really?
I think so, yeah.
Okay. Ice skater, Tara Lipinski, or President Rutherford B. Hayes?
I guess Tara Lipinski.
Hush puppies?
I properly rated.
Properly rated?
Yeah.
The state of Idaho?
Overrated.
Care to elaborate?
No.
The band Metallica?
Probably overrated for me.
So they're not going to be played in the OR anytime soon?
No, and not a big metal guy, although I would prefer that to Florida Georgia Line.
And finally, overrated, underrated, or properly rated, cheetahs?
Cheetahs? Underrated.
I agree.
Absolutely.
That's the correct answer. We actually crunched the numbers, and they are the best animal.
For me, getting to treat head and neck cancer patients, there's a couple aspects of that I really enjoy. First and foremost is just that population of patients. It can be a really complex treatment process, and it requires a lot of buy-in from the patient, because a lot of times it's not just surgery. Sometimes it's surgery followed by chemo and radiation, and after their treatment, they're not done with me. I inherit these patients for at least 5 years afterwards, just to make sure they're okay. And so it's really a partnership with me and the patient that is long-term, and I really like that. And then I also really like the team nature of it. A lot of the surgeries that I do are in conjunction with my partners. We'll switch back and forth of removing cancer and rebuilding, and sometimes I'm doing the rebuilding, sometimes I'm doing the removing. But then we also team up, partner with other subspecialties, the medical oncologist and the radiation oncologist, and we actively, in each case, come together to develop a treatment plan specific to those patients. And so there's a lot of thought that goes into all of it, and I really enjoy that. Last meal in Memphis, I think it would have to be pork nachos on the house chips at Central Barbecue.
Thanks so much for your time, Dr. Wood. We'll be talking to you soon.
Thank you. Appreciate it.